this is your list of medication that you
Yeah.
brought in that day.
I remember my shoulder. I remember all this stuff. Oh my gosh, how did you manage with me? I came in here in pieces.
Yeah.
My gosh, pieces.
Well-
The shoulder, the neck, the eye, the leg, the hip, the stomach.
All these different
Jeez,
things.
yeah.
Well, we got started before the introduction here,
Oh,
but my name is...
sorry about
That's okay,
that.
that's all right, hey, that worked out perfectly. My name is John Clark. I'm a chiropractor here in Uxbridge, Ontario, and this is a patient of mine. Her name is Sylvia, and as the video was rolling there, you heard her listing off all her issues that she came in with. Like she just said, she came in here in pieces, and we put her back together little by little. She kept coming in with new symptoms, so I kept treating new things.
They weren't new to me, they were just new to you.
Yeah, she didn't tell me all the problems she had when she first came in. The first issue was a severe eye problem, but I wanted to talk about the concept of medication. Sylvia brought in her list of medications that she used to be on. There are 8 different medications listed here, and Sylvia first came in about 5 years ago. And on here it says, when was this last filled? You know, 2014, 2013, 2014, so she does not need these medications anymore. So that's the point I want to get across, is medications have their place in the short run. If you have a symptom, why not take the medication? However, it does not give you a long-term solution. So here in the clinic at Access Chiropractic, we have solutions for many, many chronic, ongoing health problems, such as pain, and abdominal issues, and I also do acupuncture, so that opens up possibilities for anxiety. So let's talk about that. After the car accident that Sylvia had, she developed, I guess you call it a phobia for driving, so why don't you tell us about that?
Well, I did get around the steering wheel, I just couldn't drive. For a little while after the accident, even with somebody driving, it was a problem for me.
When you were the passenger?
I was a passenger, it was a
Right.
problem. That's where the anti-anxiety meds came in. And then I couldn't drive. And then after a while I would drive in Uxbridge, but that was it. I could drive from home to here, but that's it. I wouldn't go anywhere else because I couldn't drive anywhere else.
So your world was really shrinking,
Yes.
you're very limited, and you have relatives in Mississauga,
Gananoque.
right? So you'd
Yes.
have to go on the 400
Kingston.
highway,
Mhm.
400 series highways, so you were unable to do that. So tell us how we fix that for you.
Oh, you fixed that for me permanently. Sometimes there's a bad side effects to that too, because now people call me and says, hey, I want to go such and such, let's go such and such, and now I can do that.
You have no excuse.
So I have no excuse now, you know.
That's a nice problem to have, isn't it?
Yeah, so now I'm good. Yeah, I'm good. I thank you for that.
You're
Got
welcome.
me back behind the steering wheel.
Very good, but the technique, what technique did I use?
Oh, you use acupuncture
Right,
and your, what's the other one?
pain neutralization.
Pain neutralization, I can't say that word. Yeah, the pain neutralization, and it made me aware of, you know, what it was and what was happening. And then, you know, I started driving again.
Yeah, acupuncture is an amazing thing, and it can help with a tremendous number of conditions. So in her case, we use it for anxiety, there's spots for that, specifically for anxiety. And another medication you're on was some severe pain medication, oxycodone, for a severe eye problem. And you had that problem for 2.5 years.
Yes.
And now we're 5 years later, and you haven't had to take any pain medication.
No, nothing.
And your severe knee pain
Oh.
from the same car accident.
Yes, the car accident left me with a bad indentation in my leg and an exposed vein,
Right.
exposed nerve.
And severe pain there.
Mhm.
So heavy clothing like jeans, for example, excuse me, that was a real problem for you, wasn't it?
Yes, anything that rubbed against you even lightly was a problem. So I had to, my answer was to put a pad on and use saran wrap and wrap around it
Right, to protect
to
it.
protect it.
Yeah.
Yes.
Yeah, so now you don't need to do that, obviously. The pain's gone.
Pain's gone.
So the pain neutralization technique, as the name would imply, you can neutralize pain. And you can neutralize it in any part of the body, any tissue, not just muscle. So these two pains, the face pain and the knee pain, was actually bone pain. So you went to how many doctors?
14 doctors.
and including a
2
couple
countries.
of pain clinics.
Yes, yes, I went to 2 pain clinics.
And in Ontario, we have,
I got shots.
you got shots, but no permanent improvement,
No,
right?
just keep getting shots.
So again, it's been 5 years, so she has a permanent improvement with this pain. So if you're suffering of pain or anxiety or abdominal issues, that's another
Yeah.
issue that she had for 40 years, that's even worse, right? There are solutions, and we have a high success rate. So somewhere on the screen you'll see my phone number. If you have a chronic condition, give the office a call, and we can help you with the combination of techniques that we do. So I look forward to seeing you here at Access Chiropractic in Uxbridge, Ontario. Thanks for listening.